Pandemic versus epidemic. Not all infectious disease terms are created equal, though often they're mistakenly used interchangeably. The distinction between the words pandemic, epidemic, and endemic is normally blurred, even by clinical specialists. This is because the meaning of each term is fluid and changes as diseases become more or less prevalent over time. While conversational utilization of these words probably won't require exact definitions, knowing the difference is important to assist you better understand public health news and proper public health responses. Let's start with basic definitions. An epidemic is an infection that influences an enormous number of individuals inside a network, populace, or locale. A pandemic is an epidemic that's spread over multiple countries or continents. Endemic is something that belongs to a specific individual or country. An outbreak is a greater than anticipated increase in the number of endemic cases. It can likewise be a solitary case in a new area. If it's not quickly controlled, an outbreak can become an epidemic. What is a pandemic? As indicated by the WHO, a pandemic is characterized as the worldwide spread of a new disease. When a new disease first emerges, majority of us lack the natural immunity to fight it off. This can cause an abrupt, at times fast, spread of the infection between individuals, across communities and around the globe. Without a natural immunity to ward off an ailment, numerous individuals can get sick as it spreads. The WHO is responsible for announcing the emergence of a new pandemic based on how the spread of the disease fits into the following 6 phases. 1. Viruses circulating among animal populations haven't been shown to transmit to human beings. They're not considered a threat and there's little risk of a pandemic. Phase 2. A new animal virus circulating among animal populations has been shown to transmit to human beings. This new virus is considered a threat and signals the potential risk of a pandemic. Phase 3. The animal virus has caused disease in a small cluster of human beings through animal-to-human transmission. However, human-to-human transmission is too low to cause community outbreaks. This means that the virus places humans at risk but is unlikely to cause a pandemic. Phase 4. There has been human-to-human transmission of the new virus in considerable enough numbers to lead to community outbreaks. This kind of transmission among humans signals a high risk of a pandemic developing. Phase 5. There has been transmission of the new virus in at least 2 countries within the WHO region. Even though only 2 countries have been affected by the new virus at this point, a global pandemic is inevitable. Phase 6. There has been transmission of the new virus in at least 1 additional country within the WHO region. This is known as the pandemic phase and signals that a global pandemic is currently occurring. Pandemics aren't necessarily defined by their growth rate but rather by the spread of the disease. But, understanding the growth rate of a pandemic can in any case help health officials prepare for an outbreak. Numerous disease outbreaks follow a development or spread pattern described as exponential growth. This implies they spread at a fast rate over a particular time frame. Consider driving a vehicle and pushing on the gas pedal. The farther you travel, the quicker you go. That's exponential growth. Many initial disease outbreaks, similar to the 1918 influenza pandemic, appear to follow this growth pattern. A few diseases additionally spread sub-exponentially, which is at a more slow rate. This resembles a vehicle that keeps up speed going ahead. It doesn't speed up over across the distance it travels. For instance, one research study found that the 2014 Ebola epidemic seemed to follow a much slower illness progression at the local level in certain nations despite the fact that it spread quicker, or exponentially, in others. At the point when public health officials realizes on how rapidly a disease is spreading, it can support them with deciding how quickly we need to move to help slow that spread. What is an epidemic? An epidemic is an outbreak of a disease that spreads rapidly and affects numerous individuals simultaneously. An outbreak happens when there is an abrupt increase in the number of cases of a disease. It generally describes a growth that was not predicted. An outbreak can occur in a community, geographical area or a few countries. Epidemic is frequently used broadly to define any problem that has grown out of control. During a plague, the illness is effectively spreading. Examples of past epidemics are the 1918 Spanish flu, the measles outbreak from 1981 to 1991, and a 2014 case of whooping cough. What is the difference between an epidemic and a pandemic? Pandemic and epidemic are associated terms used to describe the spread of a disease. An epidemic is the spread of a disease in a community or district over a particular amount of time. Epidemics can differ based on the area of the disease, the amount of the population has been exposed, and more. A pandemic is a type of epidemic that has spread to at least 3 countries within the WHO area. A simple way to know the difference between an epidemic and a pandemic is to remember the P in pandemic, which means a pandemic has a passport. A pandemic is an epidemic that travels. How do you prepare for a pandemic? A pandemic can be an indefinite time for some individuals around the globe. However, pandemic prevention tips can help you prepare for the worldwide spread of a disease. Focus on the news reports from health agencies. News updates from the WHO and Centers for Disease Control and Prevention (CDC) can give information on the spread of the disease, including how to protect yourself and your family during the outbreak. Local news can also keep you updated on new legislation that is being enforced during the pandemic. Keep your house stocked with a 2-week supply of food and essentials. Lockdowns and quarantines may be implemented during a pandemic to slow or stop the spread of the disease. If possible, keep your kitchen stocked with enough food and essentials for about a 2-week period. Keep in mind, there's no need to stockpile or hoard more than you can use over 2 weeks. Fill your prescriptions ahead of time. It can help to have medications filled ahead of time in the case that pharmacies and hospitals become overwhelmed. Keeping over-the-counter medications can likewise help facilitate any symptoms you might experience if you contract the disease and need to self-isolate. Make an arrangement of activity in the event of illness. Regardless of whether you follow all the protocols suggested during a pandemic, there's still an opportunity you could become sick. Talk to your loved ones about what might occur in the event that you become sick, including who will take care of you and what will occur if you need to be admitted to the hospital. Pandemics in the past century. We have encountered 7 notable epidemics like COVID-19 since 1918. Some of these epidemics have been classified as pandemics, and every one of them have seriously affected the human population in some way. 1918 flu pandemic, H1N1 virus, 1918 to 1920. The 1918 influenza pandemic ended the lives of somewhere in the range of 50 to 100 million individuals around the globe. The supposed Spanish flu was caused by an H1N1 virus that spread from birds to people. Individuals ages 5 and younger, 20 to 40, and 65 and older all experienced high death rates. Congestion in treatment areas, poor sanitation practices, and nutritional deficiencies are thought to have contributed to the high passing rate. 1957 flu pandemic, H2N2 virus, 1957–1958. The 1957 influenza pandemic ended the lives of approximately 1.1 million individuals worldwide. The Asian flu was brought about by an H2N2 virus that likewise spread from birds to humans. This strain of the flu affected individuals predominantly between the ages of 5 and 39, with most of the cases happening in younger children and teenagers. 1968 flu pandemic, H3N2 virus, 1968–1969. In 1968, the H3N2 virus, sometimes called Hong Kong flu, was another influenza pandemic that took the lives of around 1 million people around the world. This flu was caused by an H3N2 virus that mutated from the H2N2 virus from 1957. Unlike previous flu pandemics, this pandemic mainly affected older people, who had the highest death rate of the outbreak. SARS-CoV, 2002–2003. The 2002 SARS coronavirus outbreak was a viral pneumonia epidemic that took the lives of more than 770 individuals around the world. The SARS outbreak was brought about by a new coronavirus with an unknown transmission source. The vast majority of the infections during the outbreak began in China but eventually spread to Hong Kong and different nations around the globe. Swine flu, H1N1 PDM09 virus, 2009. The 2009 swine flu outbreak was the next influenza pandemic that caused the deaths of somewhere close to 151,700 and 575,400 around the world. The swine flu was brought about by another H1N1 virus variant which originated from pigs and eventually spread through human-to-human contact. It was found that a part of individuals aged 60 and older already had antibodies against this virus from previous flu outbreaks. This prompted a higher level of percentage of infection in children and young adults. MERS-CoV, 2012–2013. The 2012 MERS coronavirus caused a disease characterized by severe respiratory illness that had a 34% mortality rate and ended the lives of 858 people, mainly in the Arabian Peninsula. The MERS outbreak was brought about by a coronavirus that spread from an unknown animal source to humans. The outbreak originated in Saudi Arabia and was contained primarily to the Arabian Peninsula. The MERS outbreak had a much higher mortality rate than the previous coronavirus outbreak. Ebola, 2014–2016. The 2014 Ebola outbreak involved a hemorrhagic fever epidemic that took the lives of 11,300 people, primarily in West Africa. The Ebola outbreak was caused by an Ebola virus that is thought to have been initially transmitted from bats to humans. In spite of the fact that the outbreak started in West Africa, it spread to 8 countries in total. COVID-19, SARS-CoV-2, 2019–present. The 2019 COVID-19 outbreak is a viral pandemic that's currently ongoing. This is a new illness caused by a previously unknown coronavirus, SARS-CoV-2. The infection rate, mortality rate, and other statistics are still developing. Preparing for a pandemic is a community effort that we can all take part in to lessen the impact of the illness on our communities and around the world.